Temporary guidelines for oral hygiene maintenance and oral visits during COVID-19 outbreak. Self-oral hygiene maintenance during COVID-19 outbreak. First of all, you should develop good oral hygiene habits. Brush your teeth morning and night twice a day effectively. Gargle frequently. And use the correct brushing methods to brush your teeth and prevent oral diseases. Advice for common oral emergencies. Severe tooth pain. If you have severe tooth pain, or even have difficulty sleeping at night, you can take analgesics first to relieve the pain. If you cannot relieve the pain, then go to the oral emergency room for treatment. Swelling of the oral and maxillofacial. Common infections of the oral and maxillofacial space are generally express localized redness, swelling, heat and pain in the oral and maxillofacial region, and local lymphadenopathy as clinical symptoms, which can cause body temperature rise in severe cases. You should see a doctor as soon as possible. Dental trauma. Dental trauma is commonly seen in children. If the permanent teeth are completely detached, they should be immediately rinsed with clean tap water and then placed in milk or in the mouth. They should be treated in the hospital within 30 minutes. The detach of the orthodontic patient's ligatory wire or bracket. The ligatory can be wrapped with orthodontic protective wax to expose the scraping tip. Brackets can be removed at the next follow-up visit. Parasexodus of wisdom teeth. First, try to clean the food residue around your wisdom teeth yourself, or use an antibacterial and anti-inflammatory mouthwash. Oral mucosal disease. Oral ulcers usually heal in 1 to 2 weeks. Keep a light diet and oral hygiene. Guidelines for visiting dental hospitals during COVID-19 outbreak. Wear mask correctly. Try to see a doctor by yourself. It is best to choose to walk or drive there by yourself. Cooperate with hospital staff to accept temperature detection and inquiry. If you have respiratory symptoms such as fever or fatigue, dry cough, who have visited or visited the epidemic area within 14 days before the onset, or contacted with people from the epidemic area, or have a case report in the current residential community, please go to the general hospital for a fever diagnosis to rule out COVID-19. Then go to the stomatology hospital. Reduce outings. Postpone visits. It is everyone's responsibility to prevent and control epidemics.